Assalamu alaikum and welcome, dear guests, to a very special episode of Community Outreach. Today we have a charity very close to our hearts called MAA. We're going to find out exactly what does MAA do and a very interesting trip that they do every single year, and they had to take a break because of COVID but is returning after 2 years this August. I have very special guests with us today and we're going to go through them and we're going to ask them all the questions you want, and make sure that you do tune in through Facebook, YouTube, Sky Channel 781 or through the TV1 website, and make sure you do call in and show your support. Today we have 4 guests currently at the moment. We have Famida on my right hand side, who's the UK director of MAA. We have Ayub next to Famida, who is a fundraising manager and also a Journey MAA ambassador. We have Nadia on my left, who is the Journey MAA summer lead for this year, and we have Nasim on the left, who is a Journey MAA ambassador. I want to just start off by asking, we know what MAA is, but why does MAA do the work it does, Famida?
So MAA does the work that it does because of a very important statistic that we discovered, which is that 99% of maternal deaths happen in the developing world and 90% of them are preventable, which is a shocking statistic. And once we discovered that, we all embarked on this journey of trying to find a sustainable method of trying to combat these deaths or prevent these deaths, because a large proportion of them are preventable through simple, easy methods. And so in 2015, we embarked on the first Journey MAA, and very fortunately, we've been on 4 or 5 so far, and we'll be going on our next one very soon next week. So very important cause to look up.
So 99% of maternal deaths happen in the developing world, and 90% of these deaths are completely preventable.
Yeah.
That's a shocking statistic altogether.
Very.
So what does MAA do then, Nasim? Tell me more about that.
So like we said, 99% of these happen in the developing world, and 90% are preventable, right? So there's 2 ways we aim to tackle this at MAA. One way is to medically, by setting up camps, and these are 24/7 camps that are there to dish out help and support the people nearby, but also through education as well. So by educating the youth and the women and the girls as well, and also the men, letting them know and increasing health awareness.
Fantastic. So MAA is a charity that works in global health, specifically helping pregnant women in South Asia. Currently, we're supporting pregnant women in the villages of Bangladesh, and we're also now supporting pregnant women in Afghanistan. They're doing this by running clinics throughout. Currently, they have 4 clinics, 3 in Bangladesh and 1 just now in Afghanistan. And they're doing this by providing these free medical aid. And they have a team of over 250 people trying to combat these statistics that Famida mentioned. But we keep on mentioning the word Journey MAA. But what is Journey MAA, Nadia?
So Journey MAA is one of many projects run by MAA, and it gives the opportunity for students and professionals to go over to Bangladesh and see some of the work we're actually doing in our clinics in Bangladesh. So we might not always have this opportunity. I've been a couple of times myself, but I've not been in a while. And finding MAA, it's such an amazing charity, and to be able to go over to Bangladesh and actually not just visit, but also be taking part in a cause that is so dear to my heart. So obviously I'm from Bangladesh, and it's just so rewarding as well. I'm meeting so many lovely people on the trip as well. And we're going to be meeting some doctors and students in Bangladesh as well when we're going over to the clinics, and it's just it's a remarkable, insightful trip, I'd say. Experience not everyone gets, So obviously being part of Journey MAA, it's gonna be eye-opening for sure.
So it's a 2-week trip where you're a team of UK students and professionals? Or
students, professionals, we all come from different backgrounds.
Okay.
So I'm a teacher, we've got some doctors-to-be, we've got some doctors going, and when we go over there, we've got an extensive itinerary, so visiting some of our clinics, but also getting to know some of the junior doctors there, and having some socials there as well, and just seeing what's going on there when it comes to the charity from in Bangladesh. Not just, so we do a lot here, but just being able to see what's happening on the grounds there is really important, and that's why Journey MAA takes place. Okay.
Do you have to be a doctor though?
No. So I was a little bit worried when I first applied to go to Journey MAA because obviously I don't come from a medical background, and I just thought, let me try, let me see how it goes. And they were really accepting, and they were really excited about the skills that I can bring and the knowledge that I can bring. I'm really passionate about menstruation, the health side of menstruation and the education when it comes to it. So I thought I can use my skills there. And they really valued that in MAA in general, not just Journey MAA, but in MAA as well. And I see myself continuing my partnership with MAA and involving myself more after this trip.
Oh, fantastic.
Yeah.
So Journey MAA is essentially an opportunity where UK students, professionals, you don't have to be a healthcare person at all, go to Bangladesh, spend 2 weeks in the villages of Bangladesh, different villages, and run free maternal health camps. So free health camps for pregnant women. So what do you give in these health camps exactly?
So we provide obviously education, so any of the women that might come, providing them some information regarding their pregnancy. We also provide some medicine and some support for women who are expecting. But we always get, in the past we've had children come to these clinics, and we always have, and I'm really excited about that, because obviously coming from a primary education, I'd love to meet some of these children and maybe even just give them some, insightful knowledge about menstrual health, some of the things they might need to know. And yeah, so we provide a lot of support in the clinics, both medicine and educational.
I love the fact that you said education, because unfortunately the word pregnancy is a very taboo topic in the Bangladesh community, and this is something that MAA solely focuses on. MAA is a charity that solely focuses on pregnancy and making sure that the pregnant women in the villages of Bangladesh who do not have access to these healthcare treatment, and if you're a woman who's watching this at the moment, you can imagine how fantastic the NHS service is and how much support you get. But imagine now you are in the same situation, you are pregnant, but in the villages in Bangladesh, how much support do you have? And this is where MAA comes in, as you mentioned. But you spoke about education. Why is education so important in this?
So when it comes to education, as you said, it's a massive taboo, and in order to break down these stereotypes and taboos, you have to start from education. You have to start from young, and I think that's one of the main aims of MAA, is to educate from young and prevent these taboos from continuing. So obviously, if we go over to during our Journey MAA trip, if we can educate these young women and boys, hopefully when they do grow up, there won't be that stigma attached to discussing menstruation and menstrual health, because that stops women and young females going to clinics and accessing that help. And if that helps there, we want them to be able to confidently go and access that. So it all starts with education. Obviously, I'd say that as a teacher. But yeah, no, definitely. If we could, that's one aim that I think, we are trying to push when it comes to MAA. Not just the clinical side of things, not just the medicine and the resources, but really pushing on the educational side of things.
Fantastic. I love the word you mentioned is prevent. And that's what it sounds like MAA does. It's about preventative. It's not just about having the problem and solving the problem. It's about making sure the problem doesn't exist in the first place.
Exactly.
Before I move on to my next guest, Ayub, we have a phone call. Hello, caller, can you hear me? Hello?
Hear me?
Hi, yes. Who's calling? Assalamualaikum.
Assalamualaikum. I'm Elise. I'm calling from South London. I just had a question for the panel members.
Yeah. Go for it, Elise. Nice that you're calling in.
No worries. So my question is for basically everyone, as all of you are going on Journey MAA. What are you looking forward to the most, and what are your intentions of, what do you want to bring back with you, and what's your aim?
That's fantastic. I think that's a good question, Elise. I'm going to move that to Ayub. So, Ayub, why were you interested in applying for Journey MAA?
So I think it goes back to why I applied to MAA in the first place. So the charity itself, so I've been working in the charity sector since about 2014. I was quite young, out of school, looking for something to do, but also wanting to give back. Right? And I think it's very important to have that pushed into a lot of people. They want to do good, but they don't know where. So when I joined MAA about 2 years ago, the cause of the charity, it very much aligned with my values, such as mothers, education, all these topics. Because for me specifically, my mother is obviously a very, very big part of my life, as I imagine it would be for a lot of people. And one of the main reasons why I wanted to apply to Journey MAA and go is to see for myself firsthand the amazing work that we've been doing. Obviously, it's one thing to fundraise here in the UK, but to be able to go out there and then see the clinics, see the health camps, see all the Bangladesh team in itself as well, because at the end of the day, they're also our colleagues. To speak with these people and get to know their story and where everyone else comes from, because living in the UK with our health system, we've been quite lucky, right? But then to see how heavily impacted it is there, and also be a part of that change, be driving for that change. I think that's one of the main reasons why I'm very excited to go, especially with the fact that I've been working in the charity for so long. I think it's now great to have a hands-on experience and see everything for myself.
Fantastic. I love the fact that, so you have a personal aspect, which is everyone, we've come into this world through a mother. Yeah. So we all have that attachment to our mothers. We have that respect, we have that love, and it's unconditional. And this is a way of being part of MAA. You can help other mothers in this situation, and especially in such a critical time in their life, where so many things can possibly go wrong. So you have that side where you mentioned, but you also talked about the grassroots side of it, that you are part of the charity, but you're also part of Journey MAA, and you can see the difference that you're making. I'm sure how does that make you feel?
I think it's very an honouring feeling to be able to be part of something that much different. End of the day, whether it's you yourself have made a major change or a small change, you're still part of something much bigger than yourself, right? Especially with the fact that it's, as you've mentioned before, as Nadia mentioned before, it's about giving them that education and being very much proactive as opposed to reactive. So what's the point of looking at a 99% death toll if you're not going to go do something about it? Trying to save 90% of the people, you should be aiming for that from the get-go. And I think with the fact that if you're giving everyone that education, you're being part of the education, you take it back when you come back home as well. So a part of you stays there, but also a big part of you comes back. And I think you grow as a person as well.
Yeah, love that answer. I think that's such a fantastic cause. For the viewers who are tuning in right now, we're talking about a charity called MAA, which supports pregnant women in the villages of Bangladesh. Do tune in through Sky, Facebook, YouTube, but also do call in, and we want to hear all your questions. Hopefully, Elize, listening to this, Ayub answered your question for you, but I'm going to move it on to Nasim. Nasim, what are you looking forward to most in Journey MAA?
So, the first thing that comes to mind is the fact that...
Are you Bangladeshi, by the way?
So yeah, exactly. So I'm not Bangladeshi. I'm not even South Asian. So I'm from Algeria, which is it's an Arab country, Arab-speaking country. So, one of the things I look forward to the most is to go to this new country with this completely different culture, and just, really experience it for those 2 weeks. And, not only this, but to just be there and help out as much as I can. And, one of the things that's just most satisfying in this world is to help people and to see that and to see it. It's said that to save the life of one person is to save the life of humanity. So it just goes to show the importance of helping people and giving out that aid. So yeah, those are the 2 biggest aspects for me. It's being there, like Ayub said, being there, helping people. Really being satisfied from seeing the help that we can give, because we are in a really privileged situation where we can go out and we can give out this help. So there's that aspect of it, which I'm really looking forward to. But also, the whole aspect of this, the new world, new culture, new language. It's really exciting. Yeah.
I think what you also mentioned about how helping one person also means that you're helping the whole of humanity. But with pregnancy, when you help one person, you're actually helping the lives of 2.
Exactly. Yeah. I think as well, there was a statement by UNICEF as well, and they said that to educate a girl is to educate a whole nation. So it just goes to show the importance of that education aspect as well.
Yeah, that's fantastic. So you've never been Bangladesh, I assume, before?
Never, yeah. I've never been to that side of the world, Southeast Asia.
Okay. So are you looking forward to the food, the culture?
I think the biggest thing for me, anyone that knows me as well, would be the food, because at home we don't have much curry, so I think that's like the biggest thing for me. Is to go there and experience as much as I can before coming back.
Make sure you pack the Gaviscon though.
Yeah.
Nadia, have you been to Bangladesh?
I have. I think the last time I went to Bangladesh was 2014 for a wedding, and ever since I've not been, and I've wanted to go, and obviously with COVID it's just constantly being stagnated, so being able to go now with a charity, it's it's a sense of pride as well. I'm now part of a charity that's so amazing, and I'm so proud of being part of MAA. And just going over and, you know, obviously we will see familiar faces and showing them that this is the work we're doing now. And so I am really excited. It'll be a different lens, so I won't be going over for leisure, I'll be going over for work. But it's something I'm really looking forward to. I do love Bangladesh. I love the weather, I love the food. And yeah, so it would be nice to experience it from a different point of view, not just for leisure. I have been previously as well, so I've gone for a more educational purpose. So I've been to Bangladesh with Connecting Classrooms, the British Council, and that was nice as well, seeing things from an educational point of view. And now I'm going more on a, you know, so this is more maternal aid, and maybe just putting the two together when I'm there, and hopefully experiencing it with 20 individuals or 21 individuals, which will be nice as well.
Fantastic. We have another call on the line.
Nice.
Assalamualaikum caller.
Walaikum assalam wa rahmatullahi wa barakatuh. I just turned my TV on and watching what you are saying about this medical program regarding Bangladesh. I salute you guys. We should do more for Bangladesh, this kind of programs, and encourage our youngsters to go and visit Bangladesh and see how the system is there. We are living in this country, and our children, they don't know anything about our country. So I'm really happy that you're doing a program as such. And I think this is very educational. And we should get together and do this kind of charity work and, you know, bring forward our kids to make them understand where their route is and how it is run. I mean, this is a fantastic idea. We raise millions of pounds, dollars, you know, for certain other things, but never for medical. And this young lady sitting here, this young man sitting here, I salute you guys. Keep it up, you know?
Thank you, Sir. Thank you very much for your kind words. I think what you mentioned, these young people sitting here today have done an extraordinary job. They were born and brought up here, but they want to do something else. They want to learn the skills that they have here as teachers, as future doctors, as whatever field they're in, but they're ready to take this, go to Bangladesh and utilize this through medical camps, through evidence-based approaches. So thank you very much for these words of, you know, encouragement. I'm sure that all of you, you know, how does that make you feel when you listen to that, Famida?
I think just to mention as well, I think I'm in a bit of a unique experience compared to you all here, because I've actually been on Journey MAA once before. And everything that the uncle said is everything that I was feeling when I first went, you know, back in 2018, which was the last time I had been there. And I felt the same. It was just so extraordinary to see us going on a trip to our home country or to a developing country to provide aid work as young individuals who really just want to give back, and they're passionate about what they can do with their energy while they can. And if the impact is small, if the impact is big, at least some impact is being made. And I also just am really excited for you all, because I know what's coming up for you. And also just to answer Elise's question earlier, the thing that I'm most looking forward to is, because I've been before already, it's to see how far MAA has come in the past 4 years. I think that will be amazing to see, because last I went, you know, we had health camps, we were providing care, but in that time we've opened up clinics, multiple clinics, and now a clinic, you know, in a different country as well. The amount of mothers that we can reach, the catchment population has increased a lot as well. So I think we're going to see mothers in the masses arriving. So just seeing that growth for MAA will be phenomenal for me as well.
Fantastic. We have another call on the line. Assalamualaikum caller.
Hi, Assalamu alaikum. My name's Hajara. I'm part of the MAA team. I just wanted to say I'm really proud of everybody and the work that they're doing. I just wanted to ask, for those who are younger and older, how can they be involved with the work that MAA is currently doing right now?
Thank you for the encouragement and the gratitude that you're showing all these young people today who are going to take time out from their busy schedules to go to Bangladesh for 2 weeks and provide these medical camps. And you asked a very good question. How can you get involved? To the young generation, to the older generation? And I think Ayub might be the best person to answer this. Ayub, how can the young generation get involved and how can the older generation be involved?
So there's literally loads of ways you can get involved with MAA being a UK-based charity. One of the best ways is through our events. So we have loads of events. A lot of people that joined MAA in the first place actually joined through some of our hikes. Actually, I know a good chunk of our fundraising team, they all collaborated together, and you know, they got to meet some of the older workers. I actually joined MAA through an event that a friend of mine hosted a couple of years ago. It was a iftar meal. And I think for the younger people, especially you know when you're trying to find something to do or you're looking to give back and you want to do something that's quite good, get involved with the university events. Even if you're not part of university, get involved with the charity because it's open to everyone. And then the older generation, MAA has facilities for loads of different events, such as we have the mother's tea event coming on. I think it was this Sunday.
Next Saturday.
Next Saturday, my bad. So yeah, there's loads of ways you can get involved. There's loads of ways you can help out. Don't think that just because you don't come from a medical background or you have any affiliation to medicine. I come from an engineering background. So half the time, whenever my colleagues they speak about all these medical technical terms and you know what we're doing, I'm a little bit lost. But I still love the fact that you know we've all come together for a good cause, and you know we're all aligned on the one thing, you know, trying to help out. And the more people we can get, older, younger, our age, whatever age it is, I think it's just great, and it goes to show how good and how good MAA can be in terms of you know bringing people together to here, so we can bring them over, you know, help out people.
How many universities do we have involved with MAA? How many university supporters do we have at the
so
moment?
I think we have universities all over the UK.
Can anyone help? Does anyone know the number?
Over 30 across the UK.
Yeah.
Over 30 universities across the UK are supporting MAA. That's a fantastic statistics. Nationwide. And
international.
Yeah.
And they're going international.
Exactly. I mean, we have this theme going. We have a project running in the UK that happens every year called MAA Month, where all of these university students across the UK, but now, you know, outside of the UK as well, they come together and they fundraise to support MAA. And give back to their mothers in a way that they can. And it's so much fun. It's so exciting to see the younger generation get involved in that way. And it's just amazing to see us going global. And we've been going global in our implementation projects, but also in our donor side as well, and our supporters, which is amazing to see. And just to touch on the event coming up next Saturday, it's the start of something amazing for MAA because it's a way to get the older generation involved. So what the MAA and SAR event is to bring our mothers in the communities, you know, bring them round, have tea, have biscuits, and then educate them about female health, maternal health, but also just women's health. It doesn't have to be pregnancy related. We've got the organizer behind the screen here, Karima, who can talk about that more later on. But it's the start of bringing on board our mothers here in the UK and educating them the way that we educate them in Bangladesh. And I think that's such a nice way to bring things in full circle.
That's fantastic. So this is more to the Murabbis, my dearest uncles and aunties, who must have said to their friends, to their loved ones, is my child ever going to go back to Bangladesh? They're born and brought up here. They can, you know, hardly speak very good Bangla. Why would they ever go back to Bangladesh? Well, guess what? There's a charity that allows it and does it for a very noble cause. They allow students and professionals from the UK who've never been to Bangladesh an opportunity to go all the way to Bangladesh and provide these medical camps. And I think that's such a great thing where you can be connected back to your motherland in one aspect, or if in Nasim's case, if you've never been Bangladesh, it gives you the opportunity to go and see, you know, all the Bangladeshi cultures it has to offer. Yeah. I was going to mention about the universities because I love that point. How many universities do you think we're going to get on board next year? And tell me more about this, the university project, the MAA Month.
MAA Month, okay.
Yeah.
Well, to answer your first question, how many universities do you think will get on board next year? I think the opportunities are endless. I mean, we've mentioned to the team, the globe is your oyster, I guess. So we started speaking to universities across the pond in North America and Canada. We're reaching out to people in Europe, in Italy and Spain. So I think next year we're going to be seeing numbers close to the 40s and 50s, if not more. And in terms of the number of students involved this year that we had, it was over 250 students just going on a single event for MAA. And the amount that we had raised was over £60,000 in just a single month. So the scope of this project is immense because these, if you think about it, these are just university students who are dedicating maybe a couple of hours a week for a month, if that, if anything, or they're just attending an event. But the fact that they are coming together in the masses across a nation and now hopefully globally, it just goes to show that the power that the youth have in this country and across the world as well. So it's one of my favourite projects that MAA does, and hopefully it will just get bigger and better each year.
So you're projecting over 40 universities.
I'm going to hope for more. I'll always say more. So 40 to me seems like the bare minimum we should be reaching.
And this year you did it and you raised £60,000.
Over £60,000 profit. So that to us is incredible. When we started off, I think we were struggling to reach even just £10,000 or just £5,000. So it just goes to show the power of the student.
Young people, if you are watching this,
yeah,
we are trying to get over 40 universities signed up. Currently, we have 30 universities who are supporting MAA. If you think your university is one of those, a university that you want us to come in and make sure that MAA's word is spread and that we're helping as many pregnant women as possible, do get in contact with us. How can we get in contact, guys? What's the way of getting in contact with MAA? I'll give it back to Ayub. Go on.
So literally any way through social media, email, word of mouth. It's always open to speak to anyone at MAA. I'll touch on the hike for the MAA month event actually. So I think what was amazing is that for that particular hike, so many different universities across the country, they all met together. Mm-hmm. They all managed to collaborate together. So for a common cause, we had coaches set up all around the country, up and down. Many universities from London and some from up north as well. Leeds especially, they did amazing, just as well as the London universities. And I think to get involved from there, this is one way to start, because you're part of something that will always be there, and we just want to keep building on it as we go along. So no, get in touch with our social media. If you know anyone that is part of MAA currently, speak to them. I've also asked a lot of my friends to try and get involved. That doesn't necessarily mean you have to fully commit your time as well. We also have an amazing volunteer pool where if you want to give a couple hours here and there, if you're young, then feel free to join. If there's an event that we need help with, feel free to come along. If enjoy yourself, relax, and then later if you feel like this is something I want to dedicate myself a bit more to, then feel free to apply. We have openings every year. Was it August? Yeah, August, April. Yeah.
And the best way to reach us would be MAA Global. I'll just say the social, or maacharity.org online.
So if you want to get in contact with the MAA Charity, simply go on Instagram, Facebook, Twitter, LinkedIn, you name it. It's on MAA Global. I think we have another caller. Assalamualaikum caller.
Assalamualaikum. I'm actually Nadia's sister, but I'm just calling in to give my full support. It's just that I helped her during the charity, and it helped me understand this is such a good charity. It drew me towards the charity. I support this charity a lot. I'm so glad she got into this charity. I'm proud of her.
Which sister is this, Nadia?
So this is my younger sister, Inaya.
How old is
she? She's 14. So she was just mentioning how she got involved through the volunteer pool. So I had a very last minute opportunity to fundraise in Ramadan at East London Mosque, and I needed as many buckets, as many volunteers I possibly could get. And that's one great thing about MAA. It allows volunteers to join in and sort of collect funds for MAA. And you can imagine in Ramadan in East London Mosque, it was a Dhuhr prayer. and I was sort of panicking, like, oh, there's a big opportunity here. And I reached out to my family, and I reached out to family and friends and volunteer pool, and we managed to get the buckets ready and raise money in the holy month of Ramadan. And my sister was great. She was at the Mariam Centre sort of shaking her bucket, and she was really excited. And yeah, so it was a lovely way to get people involved and spread the word in such an amazing mosque as well. That it's the heart of East London. A lot of people would say it's the heart of East London, and just having MAA recognised in East London Mosque was remarkable. And inshallah, in the future, we'll have more participation in local mosques and community centres. So yeah, my sister she really enjoyed that.
Fantastic. So you've got the whole family rounded up.
Yes.
Going to East London
I
Mosque
had my
passing.
mum, I had my bubby, I had my nephew, who's 6 months now. We were all there.
How much did you raise in that?
Just over £2,000.
Wow.
And so with Journey MAA as well, we have a target that we have to reach before we go there, and that money goes towards the clinics and some of the projects we do with MAA. And I had the target of 1,500, and I was thinking, how can I do this in one go, you know? And I just thought, you know what, let me contact East London Mosque, let's see how it goes. And I was lucky enough to get a fundraising slot there, so I managed to exceed my target, alhamdulillah. So yeah, it was great.
Fantastic. Nasim, before we go for a very short break, you're not from London, are you?
No. So yeah.
You're from Birmingham. How did you hear about MAA all the way from Birmingham?
That's what's so amazing about MAA, and that's something I find so remarkable as well. It's that even though I'm not Bengali and I'm not even from London, I'm all the way up at Birmingham. Even then, I still heard through MAA, not just through one way, but through multiple ways. So the first time I heard of it was through a friend, and we were discussing. He was talking to me about Journey MAA. Because he saw it in a YouTube video by popular medic, that medic, and he showed me the video and we were just discussing it, and he showed me this really cool opportunity to go out and help people. So that was the first time I was exposed to it. But not only that, but also through my university. So as you said, we have this thing called the MAA month, and in our university, it was quite a big thing, which was really nice to see. And there was so many opportunities and events to help out in. Lots of events to come and enjoy stuff and raise money for MAA, but also lots of different ways to volunteer as well. So again, that's what I find so crazy. Even though I'm all the way, far away, miles away, here I am still hearing about it and actively participating with everyone else. Because it wasn't just me; it was a lot of people from a variety of backgrounds. During that month, it was a whole, it was a uni-wide activity, and it was really nice to see. Yeah.
Oh, fantastic. So all the way from Birmingham,
yeah.
You're hearing about it. I think it's gone up even further than that. I think it's gone
yeah,
Newcastle, Scotland, and it's a great thing. I think when you have a message and you have a purpose behind it and a way of going forward with it through evidence-based approach, the message just goes far and wide. And this is what MAA is showing today. I think that's fantastic. Famida, before I go on for a short break, I wanted to ask, you're coming back as a Journey MAA manager. So you have more responsibilities than before. How does that make you feel?
I'm very excited, I have to say. I mean, what an opportunity then to, take lead on such a humbling project like this. And I'll be taking 20 of you with me. So please be good to me. But I'm just really excited, especially having gone before as an ambassador and now going with a little bit more responsibility, a little bit more involvement in planning the project as well. And just seeing how excited you guys will be from the experiences that I got to see a couple of years ago and more will be such an amazing feeling for 20 of you.
So you got the headache of 20 people on your head?
Let's not call it a headache. It's next Sunday, let's not call it a headache. No, it'll be very, very exciting. As long as we get to Heathrow on time, it's all good.
And the rest will be a bang.
And the rest will happen, I'm sure.
Yeah. Which part, because you've been before, which part are you looking forward to seeing again the most?
To see again the most, I guess the first health camp for me, Balagonj, will always have a soft spot in my heart for me. It was the first health camp I saw. It was my first kind of clinical experience with MAA. I also had a couple of lovely kind of encounters with mothers. One of the best things about going on Journey MAA is speaking to the mothers yourself. Whether you speak Bangla, you don't. We had volunteers in the past who weren't Bangla speaking, and they had such amazing, humbling experiences communicating with the mothers in their own way. And for me, it was speaking to the mothers in that Balagunj camp that really makes it the best experience I've been on abroad. Everyone says, well, what's the best holiday you've been on? I'm like, I don't know if it counts as a holiday, but Journey Ma for me, it was life-changing, and I really am so excited for you all to go. So Balagunj for me. But I'm also very excited to see Molly Bazaar, because when I went before, we didn't have Molly Bazaar before. So I'm very excited to see that as well, because I know this year as well, each camp has a different theme. We didn't have that before. We were just getting to grips with running the health camps. So seeing Molly Bazaar as well, seeing the clinic as well is one of the motivators for me going this year. So there's so much more that I think will be different this time around.
Fantastic. So you're doing Balagunj, Hobbygunj,
Balagunj, Hobbygunj and Molly Bazaar. Yeah.
You know, I think in the past you only did Balagunj and Hobbygunj, so now you have Molly Bazaar, you have the clinics. It's just every single year, it sounds like Ma's growing and growing.
It is. I've seen it myself. I've seen it personally. I've seen it just, you know, looking back as well, just on the implementation side, how much it's grown globally. So I think it'll be really, really kind of an honour to experience myself with you all as well.
I think, is your Bari in Balagunj?
Yeah, so I'm from Balagunj.
When was the last time you went?
So funny enough, I was born there. So I was born in Bangladesh, and this is another reason why the charity itself is very much close to my heart. Even though I've not been in the charity for as long as some other people. So my mother, she's experienced the importance, and she knows firsthand the importance of healthcare. That's why she likes the fact that I work in this charity so much, because obviously trying to give birth there is totally different story to how it is in the UK, right? So I was born there. I think I last went when I was 8 years old. I think back in 2005 or 2006, I can't remember. So it's going to be a great opportunity to go back there and see firsthand what the difference is. And also one other thing that really opened my eyes when I first heard about Ma is actually a speech that someone gave. I don't know if I have enough time to just briefly mention it or not.
I think we're just going to have to go for a break.
No, that's fine.
But we'll make sure we'll come back to that. Dear guests, I hope you learned about Ma, what Ma's trying to achieve, and the trip called Journey Ma is involving. We've had a packed first section with all your calls and questions. We're going to go for a short break, and we hope to see you very soon. Assalamu alaikum, dear audience. Welcome to another episode of Community Outreach. As we saw in the first section, we are talking about a charity very close to our hearts called MAA, a charity that works to help pregnant women in the villages of Bangladesh. They do this by running free health camps, and they have clinics providing 24/7 service, but they have this very special trip called Journey MAA, and they give the opportunities UK students and professionals to travel all the way to Bangladesh and run health camps for 2 weeks. And guys, we've mentioned that we've had Amida on the last section, we've had Nadia, but we have 2 extra new guests on the show. We just introduced, we have Bodro Islam, who's the head of the fundraising of the MAA Charity, and we also have Karima, who is a Journey MAA ambassador. Welcome to the section, guys.
Thank you for having us.
Karima, I just wanted to go to you first. Why did you apply for MAA?
Okay, so originally I was applying to medicine, and I was speaking to my sister, and I was like to her, I'm really interested in doing work back home. I don't feel like just keeping all these benefits that I've been given to myself, and I want to share that with my roots. And then my sister was like, there's this charity called Journey MAA. So actually, back before I even joined university, I had a plan that I'm going to go to university and I'm going to join MAA, and I'm going to try and get onto Journey MAA, inshallah.
So the intention for you to join MAA was for you to join Journey MAA?
Yeah.
You know what, that's what we call a passion. But why MAA though? Like, what is about the helping pregnant women that you were interested in?
So what I really like about helping pregnant women is actually what you said earlier, is that with pregnant women is that you're not just treating one patient, you're treating 2. And then it goes beyond that, because the mother is the center of the household, and she's going to be raising these children to be adults in the future. So everything you teach the mother will be passed down to the daughters, and then the daughters to their daughters, and so on. So it's a lifelong, sustainable impact.
That's fantastic. I think we have a very short clip of Journey MAA. If we're gonna go in and watch this clip just now.
Introduce yourself. This is Dr. Nabila Akhtar. I'm from Parkview Medical College. I'm an intern doctor, and today I'm leading the Journey by MAA 2019 Health Camp at Balaganj, and I'm the camp leader.
So the maternal health education seminars are currently in full swing. I'll give you a little preview into it.
Hi Nazia, tell us about your time here.
It's been awesome. What else can I say?
What a fantastic clip, where we looked into Journey MAA and what they did over there. That was the last trip in 2019, before the whole pandemic. As you could see, they were taking blood pressure, checking the urine, checking for diabetes, the sugar levels. So it's very important investigations that they were providing. Let's go into more about these health camps now. Karima, you mentioned why you applied for Journey MAA, but what are you looking forward to most in Journey MAA?
I think what I'm looking forward to most is meeting the women in the health camps themselves and hearing their backgrounds and hearing just what they think of everything we're doing. And I think that will help me to understand why what we're doing is so important as well.
That's fantastic. Have you been Bangladesh before?
So yes, the last time I went, I was really young. And actually, when I was there, I remember visiting a particular area and my dad saying, there's going to be a new building built here in this area. And I was like, but there's people living here. What's going to happen to all these people? And then that's when it hit me that this is how poor our country is, that whatever land there is, they have to set up a house and then it'll be destroyed, just like near the flood banks, just like they're everywhere. That really hit my heart. And I think since then I've just always thought, yeah, one day, inshallah, I can give back to where I'm from.
No, mashallah. And this is a great way of giving back. And inshallah, you have the ability to do that and you can do it to your heart content. And inshallah, further beyond from this as well. Yeah. I'm just going to move on to Badru, who's the head of fundraising. Badru, first question, same as Karima. Why did you apply for MAA?
Originally, I helped out an event called the Summer Bazaar. Yeah. I came out, I was stacking tables, selling sanasur. It was really popular. And then I got a call from Famida. I think she liked the work I did. And she said, oh, would you like to join MAA? Yeah. So I never really knew much about MAA, no medical, like I did international relations in uni. So I'm like, yeah, let me join. At first meeting I come, Famida's head of fundraising, I'm like, wow, these are students. And it's so professional. They have a PR team, they have so many teams. And then I learned about the cause, and then you realize like MAA make a big difference. So you raise money tomorrow, so we'll raise £60,000 via the hike, and then you'll get a call next month, we're opening a clinic. So MAA is very reactive. Yeah. So yeah.
I mean, that's fantastic. So you went from selling sanasur in a bazaar to now becoming the head of fundraising and raising £60,000 in 1 month. Yeah. I mean, that's quite the transition.
One thing about Badru though, as head of fundraising, he will still sell the sanasur at his events. He's very hands-on.
Yeah, that's fun. So why did you apply for Journey MAA?
So obviously we're raising money, me and my team. Mm-hmm. I know what the money is going towards, education, opening clinics, but I also wanted to see it firsthand. I feel like if I go Journey MAA, and then I can come back with an experience, and maybe it will help me develop me as a head of fundraising, seeing it firsthand, what people need. Mm-hmm. I'm already passionate about it, but I feel like seeing the needs of the women in Bangladesh will help me better do my job.
I think that's such an important point. The fact that MAA is a grassroots charity, we don't just raise money for it, we go and implement the projects. And that is a way of those who donate to the charity, do they have opportunity to this as well? Can they apply for Journey MAA as well, to the people who have donated?
Anyone can apply to Journey MAA. Like you can. Everyone always thinks it's medical students, but you can be in law. You don't even have to be a student. There are even a few people over the age of 27 that are going. So it doesn't matter as long as you're passionate. You have the right skills. You can apply, and then.
That's fantastic. I'm just going to move on to Nadia quickly, because if you saw in the clip, we were teaching young girls about period poverty. Why is that important, Nadia?
So firstly, for those of you who don't know, period poverty is when there's inadequate tools, resources and education around menstruation. And you can imagine when you don't have the appropriate tools or it's not spoken about, it can prevent young girls going to school. So a simple thing is going to school they might not go to school because they're on their period and they might not have the appropriate tools for that. And obviously we want to develop Bangladesh and we want to have more women in the workforce and we want more women going to school. So if we can provide that for them, both the education and the tools, it will make a stronger economy. And obviously from a teaching background, just having the thought of having students not turn up because they're unfamiliar with what's happening to them or they need advice or support through what they're going through. It's saddening that that's the case in Bangladesh. And again, we were talking about how even just talking about menstruation is such a big taboo in certain places in Bangladesh. So taking that first step, and as women as well who are going on the trip, but also men, showing women that it's normal and it's something that we should be talking about, and opening those doors and taking those first steps for them is comforting, but it also means, again, it's putting that stepping stone there so our clinics, they can come to our clinics in confidence, and hopefully the younger generation, we wouldn't have to do so much initial educating, it will already be there.
Yeah. I think it's such a taboo topic, but it's good to see that MAA's at the forefront of trying to change that. Karima, so we just came out of COVID, the whole pandemic. It's 2 years now, we haven't had Journey MAA. The pandemic, I'm sure, must have changed things in Bangladesh, and also as a medical student, must have changed a lot of things. Are you expecting that it might change stuff with Journey MAA, or do you think that MAA's come out of it even stronger?
I think personally MAA has come out of it even stronger, and also the communities have come out as stronger as well, because everyone's kind of had to adapt. And recently in Bangladesh, we've had the floodings as well.
Yeah.
So people in Bangladesh are quite resilient as it is. They're used to a lot of hardship. And when we come and help them, that's just supporting them, and it's a bit of encouragement for them when they're constantly expecting something bad to happen.
Yeah.
If anything, I think we've learned a lot more about hygiene, and we can help them to learn more about hygiene as well, and perhaps support them with whatever natural disasters may come about in the future, because we can't plan all things, but we can prepare.
I think that's very beautiful message. I think even though COVID has been one of the most testing times in our generation, the people have come out stronger, the communities are stronger. People have had to make sure that they support one another, be resilient, and through that, that support for one another, that love also grew. And Ma, I know that opened up 4 clinics in the space of COVID. 4 clinics in the space of COVID, that's a fantastic effort. Congratulations to all of you for making sure that happens. Bodru, the people who are watching this at the moment, what would you say to them about applying? Like, how can they apply, or why should they apply?
To apply, it's really, our recruitment is in July and August, and you can apply via there, or you can apply via the volunteer pool, which is all year round. You can go to our website and find it. And what was the second part of your question, sorry?
Why should they apply?
Oh, there's so many reasons. Where do I start? Obviously, the main reason is you're making a difference. One thing about MAA I love, you can raise £10, £100 at an event, or 60,000. I know that money is going to good use. All that. So the most important thing is obviously making a difference. Secondly, you get thrown in opportunities that you don't know. Like, they might tell you to host an event. For me, that made me jump out a plane, skydive. So you get thrown into all these opportunities and you learn a lot of skills. If you ask my fundraising team, they've all been thrown into the deep end and done stuff that I'm comfortable with, but they loved it. And yeah, and it's a family. MAA is a family. You make good friends, lifelong friends. And I think that's the nicest thing about MAA. That family.
Yeah. That's fantastic. So, as Bodru mentioned, this is such an important point of getting involved. I think as a young person, getting involved is more important than ever. But what is the vision of MAA, Famida?
The vision of MAA, quite simply, is to be at a point where MAA is no longer needed. So that MAA is here to provide a solution to an issue, but long term, we would like for the issue to have been resolved, because the goal of MAA is to revolutionize global maternal health care. And the way that we aim to do this is through a research-based, sustainable model that we've come up with called One MAA. Some of our viewers may be familiar, some of us may not be. But what the One MAA model is a primary healthcare model. And essentially, we also academically call it a hub-spoke model. It consists of 3 elements. The first element is to have a clinic at the center of a community. This is where we can have, I'll start actually the other way. We'll start with the
I think we have a caller as well, though.
Oh, do we? We'll come back to the One MAA model after.
Okay.
Quite long to explain.
Assalamualaikum caller. Who's calling and where are you calling from?
My name's Anas, sir. I'm calling from Poplar. Assalamualaikum, Asla and Bayez. Just had a quick question for MAA. I wanted to ask if there's any plans to expand their operation, because they've got 2 regions at the moment, but are there any plans to, like, making it a bit further? Like, what are the objectives coming around for this year and the next?
I think that's a fantastic question, and I think the best person to answer that is the UK director, a very senior role. So we'll go back to Famida on that. Anas, thank you for the question.
So definitely the vision of MAA is to expand. Like I've mentioned before, we've already expanded in the number of clinics that we've opened and the number of regions that we're in. And the goal is to slowly start to reach all of the regions, not just in Bangladesh, but globally as well. And we've seen this with the growth of moving away from just South Asia and moving into Afghanistan, where we've opened our first clinic. So I can only see our growth being even further in more countries where maternal health is such a prevalent issue.
That's fantastic. This is all the time we have, but let's wrap up, because I want to first of all thank all of you for coming down today, for all the work you've done for MAA, the work that you're about to do with Journey MAA. It's something that I'm sure that helps you, but it's also helping hundreds of thousands of people around the world and in South Asia at the moment. Famida mentioned a very important point. The vision of MAA is to revolutionize global maternal health. As we had a question, yes it is. It's to go get above and beyond. We've only just gone into Afghanistan. We're hoping to go into some countries in Africa. And this is what the vision is to grow as big as possible to revolutionize global maternal health. But the vision is for MAA not to exist at all. And you might think this is paradoxical, but they're working so hard for MAA to grow that MAA does not exist at all. Because a charity should only exist if there's a problem. But if the problem does not exist anymore, then there's no need for the charity. And we believe that every charity should have that objective, to grow to such a point where you are not needed no more because you have solved the problem. And that's what MAA's trying to do. MAA's trying to go into as many countries as possible to implement these clinics, these health camps. And this is one way of doing this is through Journey MAA, making sure that these UK students and professionals go to Bangladesh. They might have never been before, they might not be Bangladeshi at all, but they're using all these skills that they have learnt in, through the educational system in this country and through their profession, and going back to Bangladesh and seeing how this fits and implements. And that's what we're hoping to gain out of it. Callers and audience, thank you very much for everyone who's called in, to the audience who've had a massive part of supporting MAA and making sure that MAA has grown to the level it is at the moment. Hopefully you will continue supporting us, and welcome and thank you for attending another episode of Community Outreach. We hopefully will see you very soon again. Thank you.